Imagine this. It's 1999. No WhatsApp, no Zoom, just fax machines, and diplomats shuttling paper drafts between global capitals. That's how the Framework Convention on Tobacco Control, the FCTC, came to life. 4 painstaking years of negotiation driven by urgent necessity. By the late 1990s, the evidence was undeniable. Tobacco was responsible for around 8 million deaths annually and drained economies worldwide by nearly $1.4 trillion. Yet, as we'll learn through this episode, the biggest challenge wasn't just scientific, it was deeply political. From PHI Media, I'm Gordon Thane. And with me for a conversation is someone who's spent his career at the intersection of global health, policy, and diplomacy, Dr. Gary Aslanian. You're listening to the Public Health Insight Podcast, your go-to space for all things public health and global health, from the Sustainable Development Goals to the social determinants of health, as well as interesting dialogues about the diverse career opportunities that exist in these fields. Remember to subscribe to the podcast and leave us a rating on Apple Podcasts and Spotify so other people like you can benefit from our content. In terms of global health priorities, and in particular for non-communicable diseases, tobacco, of course, has been something that we've been contending with for a while. Now, amongst the other priorities that exist, what decision-making process goes into focusing on something specifically like the Framework Convention on Tobacco Control versus different instruments to address sugar-sweetened beverage industry and other different challenges at the global level? What goes into deciding what to focus on and when?
Right. So a lot of that is the combination of evidence and time to sensitize or see that evidence play in a particular way in countries. You mentioned the Framework Convention on Tobacco Control. That's something that was negotiated under WHO. And it's actually been 20 years in 2025 when it was negotiated. But obviously the world knew about the evidence about tobacco way before that. So that's what I'm trying to say. There's certain things now that are coming in. You know, you talked about the sugar and beverages, etc. These things have early evidence, and then we kind of collect that evidence, and then who knows, in 20 years we may have something there. And we will look at it as a public health issue that needs to be collectively addressed, right? Also, countries come around with a convention such as that for tobacco, not because they have nothing else to do. They realize that they alone cannot do enough to control, right? Take, advertisement of tobacco. If it was not really banned in a way under FCTC, where is the border? You would see that all over on social media. So you can have all the laws in your own country around banning tobacco to children. But if it's not a law in some other countries, your children are exposed to that. So even now, even more global efforts, and that's a whole other episode about AI and health. But if you take AI and health, sure, every country will have a plan. But eventually they'll have to come up with something that is going to kind of be at a broader level. And with FCTC, which for short for the tobacco one, I mean, it started in 1999 and took about 4 years. Remember, 1999, no text messages, no WhatsApp, no, maybe fax, I guess. And all of that had to be done back and forth between different negotiators and capitals and countries. But really the condition to do it was the tobacco epidemic was really a global issue. There was more liberalization of trade, more marketing of tobacco in that process. You know, new markets were opened and for tobacco companies. And this all had really devastating effect on on the environment, on secondhand smoke, on economic development because people got sick and, had all of those tobacco-related illnesses.
Tobacco isn't just a health issue. For some countries, it was deeply political. Take Uruguay. In 2010, President Vasquez famously took on tobacco giant Philip Morris over giant warning labels on cigarette packs. Philip Morris sued, sparking an intense legal battle lasting 6 years. Ultimately, Uruguay prevailed, a powerful precedent for smaller nations. But not every country has the resources or political capital to wage that type of war.
Hence, something had to be done to reduce the demand for supply of tobacco and measures around promotion of health and regulation, packaging. The list is long, huh? Like, there's not enough time to go into every single aspect, but just to say that it's a comprehensive tool. So it took them 4 years to negotiate, yeah?
So what I'm hearing from you, and it helped me understand a little bit more as well, is on one side you can have a growing or a pretty well-established body of evidence that something is indeed harmful, and we understand the degree to which something is harmful, like tobacco. But what I'm also hearing from you is to develop something like the FCTC, you then need a body of evidence in terms of the interventions that are effective to then recommend those for broader country adoption. So it's not about sounding the alarm bells and not having solutions. It's about kind of the two going together. Would I be right in saying those are the necessary ingredients to bring something like the FCTC together?
Sure, that's definitely part of that. And also, things play out differently at each country level. And in some places, there are stakeholders that play a bigger role than the others. And when it comes to, let's say, production of tobacco, sometimes still is in many places, that's a livelihood. People produce tobacco. It's a part of agricultural mix of a country. So that country is going to say, okay, what am I going to do? How am I going to do this, right? So all of these things take time, and they're not necessarily all in health or what we like to do. I mean, we public health people tend to do. I'm hopefully moved on about 20 years ago from having that. But we tend to only think of that, but there's way more than that. There's also basically economic, tax benefit for countries. So each one had to kind of come to it in their own way, their own time. And so it's not a surprise that it took so long. Actually, having the framework in place is only the beginning. Then you have to ratify it. And not every country actually ratified it. A majority of countries have ratified the convention because it's signing it, it's the only kind of the first step of any of these things. Even a free trade agreement, something topical for our current days, they don't just go and sign in a little room and then that's it. These things go and get ratified and then implemented, etc., right? So it took a few years after to ratify.
Signing a treaty is like swiping right. It's just the first step. Ratification is the first real commitment, but not everyone showed up. Even today, 34 countries still haven't fully ratified the FCTC. Why? For some, tobacco isn't only a health crisis, it's a paycheck. In Malawi, for instance, 60% of farmers rely on tobacco farming as their primary source of income. The FCTC faced a difficult challenge of balancing public health with economic realities, a tension that would define its ongoing implementation challenges.
And the good thing also about the Framework Convention was that it was called framework so other things can be negotiated later. Because not everything would be possible to negotiate right away. And we see that currently with the pandemic treaty, where certain things might be left to future. In case of tobacco control convention, there was later on what is called the Convention on Illicit Trade of Tobacco. And later now we're seeing other tobacco products and vaping products at the moment. So we'll see where that goes. But that's the beauty of the kind of overall umbrella under which the parties of the convention can establish mechanisms to discuss. So it also allows for that.
So you mentioned framework, so other things could be negotiated later.
Yeah.
I'm just trying to understand in terms of future negotiations to make it more robust and responsive to the modern day state in terms of vaping products, flavored tobacco, chew, and those types of things. I guess what I'm saying is if it wasn't developed in a way as a framework, would that mean that if you wanted to do something in the future that you had to start essentially from scratch and go through the whole process again? Is that the benefit of developing in the way that it was developed?
So the benefit in a way it was developed was basically the everything else that might be related to tobacco control, right? This is a convention on tobacco control, right? So no other things, but everything else related to tobacco control could come here for further negotiation, and if needed, other kind of instruments could be established to deal with them, right? So I think that's a very good side of the convention that it doesn't kind of stop there. And I gave you the example of the illicit trade of tobacco that ended up being something added later. This is not an area I work on daily basis, but I love this because it's such an example of what public health can do at global level. So everyone who works in public health, if you have time, look into that a little bit more because it's just a beautiful example of what we can do if we put sort of global collaboration and cooperation to keep us healthy.
Negotiation might seem foreign to public health, but it's at the heart of every global health treaty. Think of it like this. What levers can countries pull when others resist reducing tobacco supply, increasing taxes, or tightening regulations? As Giri mentioned, ineffective negotiations can unintentionally fuel illicit trade, essentially an underground market bypassing public health measures. If the FCTC is a digital lock securing global tobacco policy, illicit trade is sort of the unauthorized backdoor. Effective negotiation protects that lock, keeping tobacco controls secure. I want to go back to the negotiation piece because I find that a bit fascinating because I feel like even the concept of negotiation is not something that's public health professionals think about on a daily basis, that a lot of the policies, all of the policies that are implemented at any level required some negotiation, give and take, concession. Now, when you're talking about negotiation in this context, you did mention about tobacco, like the tobacco farming countries that make a significant revenue from the agricultural side of tobacco and the importance of shifting that agricultural function to produce other things like food that could still sustain an economy and be useful.
Right.
I imagine too, the way you describe it in terms of supply and demand is reducing some supply and demand simultaneously, because there were examples, you talked about illicit tobacco trade. There's examples with alcohol prohibition and the way the availability of prescribed opioids was suddenly decreased. When you have a demand and you don't reduce the demand with the supply, it can lead to other markets coming up. So I imagine a lot of those discussions were a part of how this treaty was developed.
Right.
Can you talk about that, and as well as beyond the member states, were there any other actors involved in influencing that conversation?
Sure. So, well, because it's done under the auspices of WHO, because WHO kind of resolution established that process. So they established like a working group of member states who are interested, and then intergovernmental negotiating body that did that work over the 4 years. It's all really comes down to states. So states play a key role in these kinds of things, and includes all the countries that are interested. And I mean, usually a mixture of small, big, rich, not so rich, But obviously, other players come in. That would be non-governmental organizations, and let's say those who are really focused on strong tobacco control measures. And in case of Canada, we had Heart and Stroke and Canadian Public Health Association. They were really interested to make sure that the Canadian negotiators or those who were negotiating were really looking at the right issues and prioritizing right aspects of that. Then you have maybe some other organizations that are observers, again, because of the intersectoral kind of way, let's say the International Organization for Agriculture or others, that they will also play a role. But then you have the sort of the for-profit or the business, and in this case, maybe the tobacco companies. And that would vary because not every country has sort of production of these things, but they would not be in the room. So just to make sure nobody gets the sense that any of them are in the room.
Let's pause to catch a breath for a second. Gary mentioned tobacco companies weren't physically in the negotiation room, but were there shadows in there? In the early 2000s, leaked internal documents revealed tobacco giants like Philip Morris actively planned to delay and disrupt the FCTC negotiations. Years later, to counter incidents like this in the future, WHO introduced a framework of engagement with non-state actors, otherwise known as FENSA, in May 2016, during the 69th World Health Assembly. FENSA serves as a robust rulebook, clearly outlining how WHO engages with private corporations, NGOs, and academia, effectively barring companies and sectors and industries like big tobacco from influencing treaty negotiations. Think of FENSA as sort of global health's strict bouncer at the club, keeping powerful commercial interests at bay.
But they also are constituencies in countries, and that would also vary. I mean, if you remember, maybe in the 90s or mid-90s, late 90s, some health systems in Canada were suing tobacco companies for a damage. So, I mean, it's a bit hard to obviously be such a strong lobby when you have all of that in case of, let's say, the tobacco companies. But they play a role. And I'm trying to kind of generalize for global audience, let's say, that it will vary from country to country. But the member state is one that actually negotiates it. Nobody else really negotiated.
And tell me about, when I was researching for this, something called Framework for Engagement of Non-State Actors, FENSA.
Oh, yes, that's a whole other thing.
Was that in place before this?
In fact, it was not in place before this. The FENSA, or Framework on Engagement of Non-State Actors, it's something, again, negotiated. I don't want to sidetrack because I can talk about that one too forever. But it's also something that the member states wanted to have well-established rules how WHO and its member states in their work interact with non-state actors. And when we say non-state actors, that's business, private business, NGOs, universities are non-state actors. I don't know, radio stations. I mean, the list is long. Okay, every kind of non-government organization. And that's more recent, maybe last over 10 years, maybe not more than that, or even around that time. I may need to check that date, but it just gave us a bit better framework how we engage with them. But I don't want to mix these two things together.
Do you have an idea for a topic you want us to cover, or any questions you want to ask us? There's a cool new feature that you can use wherever you are in the world, which allows you to instantly send us a text message at no cost to you. All you have to do is open the full episode description in whatever platform you're listening from and follow the instructions at the very bottom. We'll be sure to give you a shout out in the next episode that we record. Now back to the podcast. It ties back to people's lack of trust for how things are developed and for the system. So understanding the different checks and balances that are in place to
Yeah.
prevent that is helpful for people to understand.
Perfect.
But
Yeah.
now in terms of the FCTC,
Right.
global tool, global treaty developed, I imagine countries had discretion for how they then implemented what
Yes.
was in
Yes.
there, and then the
Yeah.
pace that they would, and the targets and goals that they would set.
Yeah.
Was that part of the negotiation process too?
Yes. Yes. And of course, even in the process, there were many consultations. I mean, if you take one for us very important in Canada would be Aboriginal organizations and production and use of tobacco and all of that and any other cultural or otherwise nuance that needed to be verified and checked and consulted on. And in case of Canada, obviously, Canada negotiates it for itself, but it doesn't do it without provinces and territories. And same goes for, then it ratifies, as you say, then you really start implementing. That also is a certain process. So I already mentioned that people see the framework, but it doesn't mean that everyone ratified it. So that took time. Some ratified it faster than others. And then after that, they'll come to implementation, meaning some of the aspects of it, be that for advertisement. I'm just give you some sort of parts of that framework when it comes to advertisement, when it comes to taxes, when it comes to advertisement for minors, to minors, sort of how the distribution of funding from health promotion, kind of how that needs to be done, etc. That all kind of needs to be figured out. And it takes time. I mean, in 20 years, I'll just maybe give you one kind of nugget of information. I read recently that we have about 5.6 billion people, or about 71% of the world's population currently are covered by at least one tobacco control policy. No? And that's almost like 5 times more than in 2007. So just to say that it takes time. And since its implementation in 20 years, and the rates also, we see through studies or the reporting, the rates of both tobacco use and the impact it has on non-communicable diseases and specific diseases took time. And each country did it in its own way. I don't know if you want me to give examples of countries, but we can pick any if that's helpful. But it's just, there are different stages. Maybe that would be better to think of it.
The stages.
Like there'll be like legislative measures, things like control legislation. It's public spaces for use of tobacco. I mean, you probably watch movies still when people smoke in offices. That doesn't happen anymore. Well, not as often, basically, or I hope not anymore in most of the places. Then tax measures in terms of how taxes were added on the tobacco products, and that then revenue generated, and what will happen with that revenue generated from that. Then things like public awareness campaigns to kind of sensitize population to those new rules around non-smoking areas. And then also, people always forget that people who are addicted to tobacco are human beings. It's not like they are not aware that it's very difficult. It's really not an easy thing to do. So you have to put into place tobacco cessation programs with global guidance, but local relevance, to come up with, counseling or certain therapies. And not everyone succeeds. So it's unfortunate, and we shall never kind of blame the victim of the tobacco, basically addiction. But sometimes it takes time. And then you have, enforcement measures, monitoring, and then kind of you have to kind of also have some kind of a process to measure the impact of what you're doing, and all of that needs to be part of that. And also international cooperation, because not everyone has the answers. So in that process, countries had to share experience and evidence of what works and what doesn't work, and why should certain things be changed halfway through, and all of that. And in our case, I mean, in case for Canada, jurisdictional authority when it came to health, I think wasn't a huge thing, but it was still there. I mean, in terms of implementation and who funded what from national level, and what was funded through provinces, and for what kind of programs. We have fiscal transfers between federal government and provincial governments when it comes to health. Are they used for tobacco control or not? Or are they used for other things? So it's not an easy thing, but we also have a very, very strong, and in some countries, I'm giving the Canadian example because that's very important, I think. Not every country has that very strong non-governmental, non-for-profit NGO sector that helps, and we shall not always have that. It's not a criticism, just a reality that it doesn't exist always in all the countries. To be that watchdog from outside of the government to make sure that things are done, and not only done, but also done correctly.
Now, how does the FCTC be responsive to the modern day challenges when you think about e-cigarettes, where you're getting synthetic nicotine that's not necessarily derived from tobacco? Is that outside of the scope of what the FCTC might address? Can you walk me through how that plays out in the modern day context? Because that's what we're seeing, is a lot of those nicotine sort of being the addictive property in tobacco being synthetically engineered and being included in products. Does that fall out of the regulatory framework of the FCTC?
So for that, you would need to establish new mechanisms. And as I said in the beginning, the beauty of it is that if enough countries come up with the need let's say, to address the sort of vaping products, there is a process to do that. And the Framework Convention would cover that, and specifically there are some things that are there, but certain things may not be there. So because it's only been negotiated, 20 years ago, right? Right. So then there are things that are called conferences of parties.
Okay.
So that's maybe once a year, where those who have signed, and party here is the member state that you probably have heard what is called a COP, which is COP for climate. So certain similar things exist for FCTC when the Conference of Parties will come and look at these new things and expand or not expand into sort of emerging products or emerging sort of things. So that there is a process for that. I would have to double check exactly where they are with that, but definitely FCTC can address that.
Okay, that's good to hear.
Yeah.
So to bring it full circle now, as someone I think earlier I'm still a maybe early career professional. I've worked in chronic disease prevention. I've worked supporting smoking cessation programs, the health promotion around tobacco prevention, smoke-free spaces. I've worked in that. And I think some of my counterparts may not necessarily see themselves as vehicles through which we implement the practices in the FCTC. We see ourselves as sort of shaped by the policies, and our work being shaped by the policies, but not necessarily the other way around. So when you describe it as sort of the WHO member states making decisions and the delegates being the Ministry of Health in most cases, what role can I as an individual practitioner have in helping shape these more global policies and not just be a tool to implement them?
Right. So it will not be very different from everything else you'll do with a provincial or a federal Ministry of Health, right? We advocate with provincial or federal ministries for certain things, right?
Right.
We want to influence the policies of our governments at different levels, local or municipal, provincial, federal. So the influence on how Canada also or another country behaves or negotiates or prioritizes, list is long, depends on how much influence we want to make on them. And we just need to recognize that it's really impossible for us to achieve certain things at local level without global kind of leadership and global approach that will help us to do our job as public health professionals on the ground. So, yes, it's a bit of a stretch of imagination right away, but simple things like public support. I mean, we work with public health professionals, you work with community to support health initiatives in the community, in your area. So that should also kind of include that role for, the global nature of a lot of the public health issues and how only through a global effort we will actually achieve some of these things. No matter how rich, poor, developed, not developed, have capacity, don't have capacity. So that is one other way. I would think that sort of engaging in constant professional growth and development also is important. We do that anyway for skills that we need to gain because everything changes with the speed of light. And when it comes to communication, leadership, use of new tools. So that shouldn't be any different when it comes to how does a country where you are shapes global approach. So there shouldn't be a separation. One just needs to think these are at different levels.
Right.
And at some point, you're able to do this at that level. And later on, you can spend more time doing it at a global level. And you don't have to do it alone.
Right.
So you can also kind of make sure that a public health group or your health unit or you belong to professional association always includes a global angle simply because that's in the world in 2025, not to think of it is short-sighted.
And would it be fair to say an accessible way would be, I've been a part of public consultations where the government puts out calls on a specific topic about or ideas for implementing policies, and you as an individual even sometimes could submit something,
of course.
or as a professional association, as an organization, could do a joint submission in terms of your perspective.
Exactly.
Would that be?
That'd be, and when you live in countries when that's open, transparent, and it's done, why not use that? And we shall never take that for granted as well. So I think we sometimes forget the power and the beauty of that. And I mean, again, it's going to help your work at your level.
Right.
That's what you need to think of. You're not doing it for some others. You're doing it for yourself and for your own professional effectiveness and your professional impact that you want to achieve, and go home and say, I've been able to do this. This is what I do. But I also am able to have an outcome that is both local and global.
Right. It's very rewarding. I've been a part of one where there was a consultation around the plain packaging and the imagery and change. And then when you see a year and a half later that it's implemented, it feels very rewarding too.
Because you see yourself in it, yeah.
That's right. It reinforces your ability to do public health practice even better because you're contributing knowledge which then gets implemented in policy and then gives you more of a flexibility to take more public health measures in your local community. So I like that you brought it full circle, Gary.
No problem. Thank you.
All right. So let's recap this one. We trace the story of the FCTC, the Framework Convention on Tobacco Control, from intense global negotiations in the late 1990s to its ongoing struggles balancing public health with economic realities. That said, it's viewed as widely successful in its adoption. But we saw how politics, economics, and public health intertwine in complicated ways, shaping the global tobacco landscape as we know it today. Coming up next, a conversation on the Pandemic Treaty, a tool for global health security. That's next time on the Public Health Insight Podcast. This show was edited by me, Gordon Thane, with additional editing from LaShawn Benedict. Sound design and mixing by myself and LaShawn Benedict. The original music from The Music Room, composed by Tom Fox, licensed from Johnny Harris. The cover art designed for our show by LaShawn Benedict. The Public Health Insight Podcast is produced by PHI Media. Thank you for listening to the Public Health Insight Podcast, your go-to space for informative conversations, inspiring community action. If you enjoy our podcast, be sure to subscribe and leave us a rating on Apple Podcasts or Spotify. See you in the next one.